rhetoric. Here with me now to talk about the House plan for that and much more is Speaker of the House, Nancy Pelosi, Democrat of California. It's great to have you, Madam Speaker. Let me start on testing. I know that's a focus of yours and of House Democrats and Senate Democrats. You know, people will point out we are doing much more testing than we were before. There's even some states like New York that say that we have more testing capacity that's currently being utilized. What's the failure here? What's the shortcoming that you want to see rectified in terms of testing?
Well, right from the start, March 4th, the first bill that we passed on COVID-19, we wrote it in February. We passed it in the House on March 4th. Testing, testing, testing. Testing to save lives, testing to open up the economy, testing to send our children back to school. It never was fully implemented. We had it in other legislation, and now in the HEROES Act, we have it in a very robust, rapid way. Testing with a strategy, testing with a timetable, with benchmarks, with time milestones, so that we are able to identify the extent of the problem, to treat those who might be positive, to trace those to stop the spread. This is essential. And it is such a disappointment that we have not made the decision at the executive branch to do what is very clearly indicated by all of the scientists need to be done. We need to test. We're not testing enough. And we should be testing even more people who don't have symptoms, because this is asymptomatic. Some people who have it don't even know it. But we have really failed in this regard because there hasn't been an execution. The executive branch has not executed a testing regime. That's why the HEROES Act is so robust, so rapid, in terms of the resources also that are necessary to do so.
So what I'm hearing for you is that there's both a sort of overall capacity issue and also targeting, right? That there's not enough tests being run, that those tests aren't focused on the people that need to be tested in terms of contact tracing. I want to ask about another part of the HEROES Act as well. And it's interesting because in between the last time you and I spoke about this legislation and now, right, there's been some real changes in the noises that are coming out of the Senate, particularly Senate Republicans and leadership in the White House. When you introduced this act, the message from the White House and Mitch McConnell was it's dead on arrival, nothing more, we're done, we're going to see how this goes. They seem to have had a change of heart over at the Senate, Mitch McConnell, the White House, I think particularly on aid to state and local governments. Is that your understanding of where things are now in terms of what the Senate or the White House are considering for another round of legislation?
Well, they can't ignore the fact that states are going to have to shut down services, fire people, raise taxes, or all of the above. States, counties, city municipalities, and the rest. They can't ignore that. And they're hearing a drumbeat, a bipartisan drumbeat across America, that needs to be done. And by the way, in the testing, we had significant funding for the states to do the testing that they need to do at their level. So they can't say that. But, you know, frankly, as I said at the time, when they put forth a bill, everybody said it's a first offer. When I put forth a bill, they said, oh, it's partisan. No, it's a first offer. And we know we have to negotiate. But we know we do have to have state and local assistance. We need to protect our heroes. That's why it's called the HEROES. Our healthcare workers, our police and fire, first responders, teachers, sanitation workers, food workers, transit workers, you name it. They're our heroes. They deliver our services. They risk their lives to save lives, and now they may lose their jobs. So that has to happen. The testing has to happen if we're going to open up our economy, and the money in the pockets of the American people has to happen if we're going to, again, rebound from the terrible place that this terrible virus has taken us. So, yeah, I think that they knew that they would have to do that, but it was their message. She's partisan. When they put it forth, they're not partisan. They're Republicans. When we put it forth, we're partisan. But they'll come around. And maybe it's a girl thing.
One of the other items. Well, do you think it is?
Who knows? Doesn't matter. They'll come around.